March, and I just need to advise everybody that we recorded for public. I'll start again as soon as this person has joined. Hi, Richard.
Hello, everybody.
Right, so thanks everybody for joining us. Again, it's the 16th of March, and welcome to the ward meeting. The meeting is being recorded for public record, and in a few days it will be available on both the Birmingham City Council website and on YouTube. So thank you all very much. First off, I'm going to go to Dr Justin Varney. Thanks ever so much for joining us, Justin, and he's going to give us an update on the health situation at the moment.
Okay, thank you very much, Councillor. So I'm going to talk briefly about where we are as the city at the moment with COVID. I'll touch a little bit on what's happening with testing and in vaccination, and then I'll talk a little bit about what's going on in the ward specifically. So overall, we're seeing the case rate now in Birmingham is coming down quite dramatically, and we're down to about 76 cases per 100,000. And that's back to about where we were at the beginning of September, so quite a significant reduction. We're ranked about 48th highest in the country out of 150 local authorities, so we're still in the kind of top third. But we are definitely coming down, and the spread continues to be predominantly in households, but actually also workplaces are flagging quite strongly at the moment, and that's one of the areas that we're very keen to see more emphasis on workplaces testing staff regularly every 3 to 4 days. We are seeing hospital admissions coming down, which is really good news. We're down to about 20 to 30 new cases a day across the hospitals in Birmingham, and about a month ago we were tracking at over 100 new admissions a day, so it's quite a big drop. And that really reflects all of the hard work that everyone is doing, staying at home, keeping space, washing your hands, and wearing a face covering when you're going into other spaces. Many of you, I'm sure, are aware about testing and what's going on with testing at the moment. We've now got more and more access to the lateral flow rapid testing availability. Children in secondary school are now being tested. They're tested 3 times in school, and then they start to use home testing kits. And the parents and childcare bubbles of children in primary school can access testing kits, and they should be testing every 3 to 4 days, and they can access them either online to get them sent home, or you can pick them up from one of the local testing sites. And I think the closest one for you in the city is probably going to be the one in Sutton Coldfield Town Centre, and parents can pick up testing kits in the afternoons from that site.
Justin, is that the town hall?
Yes, it's the one that's actually it's the car park one, kind of around the back of the town hall. Yeah, that's so and normally you can go on the government website, you can put in your postcode and it'll tell you where you can pick up a test kit closest to you if you're a parent. We are opening up more collection sites across the city, and that's to do with us getting the kits off government to be able to give them out. And I hope those will go live next week through our lateral flow testing sites. Lateral flow testing for everyone else is predominantly through the testing sites, and we have 7 of those across the city. A new one just opened in Sutton Mere Green on Monday. And that's at the community centre in Sutton Mere Green. We are looking at another site which I think is going to be kind of at the bottom tip of Sutton Trinity, so probably going to be a bit more convenient for you, because I am conscious that Sutton Coldfield's been underserved when it comes to lateral flow sites, and we haven't had quite as many pharmacists as we would like taking up the ask to distribute lateral flow. We are working with businesses to support them to roll out lateral flow. Sorry, Councillor.
I wouldn't like to volunteer them, but we do have an independent pharmacy in Warmley that might be worth approaching outside of the big groups.
Do connect them to us, because it was offered through the local pharmacy committee to all pharmacies, and I have to say most of them taking part are the independent pharmacies rather than the chains. So yes, do connect them up to us. There is on the council website now an interactive map where you can put in your postcode and it will tell you where your closest testing site is.
Can I, sorry to interrupt, you know, you mentioned that, so I don't know if I can mention this, so I've just you know, you mentioned about picking up the test kit from the town hall, the car park. You might be referring to Plantsbrook maybe rather than the town hall, because the town hall's a vaccination centre.
Yeah, it's not the vaccination site, it's the testing site.
Yeah, which is not the town hall actually.
No, it's around the corner.
Yeah,
okay. Absolutely. So it's the testing site, and you do have to go online and book to pick it up there. It's not, I don't think it's just turn up. So parents should be getting information from your schools directly about where you get your testing kits, and it's important you keep close to what your school is telling you, because over the next couple of weeks you'll also be able to get those testing kits from pharmacies, but that's not going to go live until the end of March. So gradually it's kind of opening up. Businesses can register for testing kits to set up testing site in workplaces, but they only have until the 31st of March to do that. So it's really important. Businesses of any size can now register to get testing kits for free. And that's the important bit, because we understand that that free offer isn't going to last forever. So really encouraging businesses, and we'll be writing out to all businesses in the city early next week to explain how to do this, but also to show them where we've got some webinars with teaching, and we've also got some classes available, so you can send your staff to learn how to run a testing site as well. So I'll now just talk a little bit about what's going on in your ward itself, and bear with me while I just get the data up in front of me. So in terms of Sutton Reddicap at the moment, you're currently ranking 53rd out of 69 wards when it comes to numbers of cases of COVID in the last week up to the 13th of March, and there were 6 reported cases in the last week. That gives you an overall case rate of about 60 cases per 100,000 population. And the overall case rate for the whole city is running at about 74 cases per 100,000 for the whole for the same time period. That ranks about 41st out of 69 wards. There are only 3 COVID champions in the ward, which is, I have to say, quite disappointing. I really encourage anyone watching the ward forum to please sign up as a COVID champion. It's a way where you get, you get an opportunity to have an hour with me or one of my senior team every week and ask me any question you want around COVID, but we do education sessions every week for the champions. And it's a really good way of us getting intelligence from you about what it's like on the ground. So the champions have helped us change our approach to lateral flow testing. They've helped us develop more support for people who are isolating. So there's a really good opportunity to actually influence in real time what the city's doing. And also on vaccination, we've had some really good sessions with local GPs coming, explaining vaccination, but also listening to the champions about what could be done better. So do sign up, because 3 for the ward, I'm afraid, is very low. Our top runner has about 30 champions for the ward, and I think that's Lazelle's. So you've got a way to catch up with them. We look at the demographics of cases over a month, because obviously when you've only got 6 cases in a week, it's not really enough to kind of say this is different or that's different. When we look at the demographics over the month up to the 13th of March for the ward, 42% of new cases were aged 20 to 39 and 38% were aged 40 to 59. So it's very, very clearly working age adults, the highest number of new cases, and 84% were in the white ethnic group. Now, I think the ethnicity very much reflects the ethnicity of the ward, but I think the age profile is slightly younger, and interestingly, the rate of cases in children in the ward is much lower than the Birmingham average. So for this period, about 17% of new cases were in children and young people under the age of 19, and it was only 11% in Sutton Reddicap. So there are some differences, and I think that may, from my perspective, I'm looking at that and going, are there any workplaces particularly we need to look at in the area? Things like that, that often are the spaces in which people are catching the virus. It's when they're going to work at the moment more than anything else. Vaccination uptake is good. And we've just published an update on the data for ward level data this evening. 92.3% of over 80-year-olds in the ward have had their first dose of the COVID vaccine, which I think is brilliant news. It gets even better that 75 to 79-year-olds, it's 96.9% uptake. That's one of the highest in the city. And actually, it's above 90% in everyone over 65. Now, some of that, I think, is because the population of the ward is slightly younger than some of the other areas in Sutton Coldfield, but it's still very, very impressive. Where we have some concern is the uptake in the group of people who are considered clinically vulnerable. So that's the group of people who are normally eligible for the flu jab. That's only running at about 75% at the moment. So there's a bit of a way to go, I think, in that area to improve the uptake. But in general, this is one of the wards that I have to say I'm very pleased with the uptake, and it's a reflection of the local GPs in the area, I think, who've done a stellar job getting the vaccine out into the community, and also credit to the community who've responded so positively. Finally, on vaccine, I'll just pick up the point that's been covered in the media about the clotting risk of the vaccine, because I'm sure it's on people's minds, and it's important, I think, to respond to that. Blood clots happen normally. So in any given year, about 2 in 1,000 people in the general population will have a blood clot, normally in their leg. It's a thing called a DVT. And that incidence, the frequency of that increases as you get older. So in people over the age over 80, 1 in 100 people each year get a blood clot. So given the number of people who've been vaccinated in the city, which is over 219,000, based on that frequency, we would expect to see 806 people have a venous clot. The other type of clot that we see is clots in the lung. They're less common. It's about 7 to 8 people per 10,000 adults every year. But if you apply that to the number of people who were vaccinated, we would expect to see in that population 174 people who have clots in their lungs that would have had them at any point this year. It would be completely normal. Now, the news reports are saying there are 30 cases of blood clots in the population of people who've had the first dose of the vaccine across Europe, and that's about 17 million people. So you can see, just based on that maths, that's a lot lower than what we would expect in normal times if the vaccine didn't exist. So the Medicines Healthcare Regulator in the UK, as well as the European regulator and the WHO, have said there is no evidence of increased risk of clotting associated with the vaccine. And when you look at what we would expect to see in a normal year, we're nowhere near those high levels. The final thing to say on this is we do know there is absolutely an increased risk of clotting if you catch COVID. Many people who have COVID ends up with clots in their lungs. Even in intensive care, when you're on medication to stop your blood clotting, about 1/3 of patients with COVID will have a major clotting event, even when they're on medication to try and stop that happening. So we know COVID in its own right causes a lot of clotting. And that's one of the things that will be being investigated about this small number of cases is, are these people who already had COVID when they had the vaccine, and it's the COVID that's been causing the clotting? And it's an important difference because the COVID vaccine only includes a little bit of the COVID virus. It's not the whole virus itself. So that can't cause clotting in its own right. It's only the whole virus that can. So I hope that was helpful, and I tried to cover a bit of some of the current issues and topics that I know people have questions about, but happy to answer anything else, any other questions you have for me.
Thanks, Justin. Does anybody have any questions on that? No, well, I would just like to say thank you to you and your team, as well as all our GPs and all our volunteers in Sutton Coldfield. I know Richard's one of those that volunteers. I think you're all doing an absolutely tremendous job, so many thanks. And I think you probably deserve a rest as much as most, Justin.
Thank you very much. Have a great evening.
Thank you. Bye-bye. So thanks, everybody. And John Moore is now going to give us an update on the Commonwealth Games. John, thank you.
Thank you, Councillor. Hopefully it's not news to anybody, but we are getting the Commonwealth Games. So there you go. As part of the programme, we want to sort of look towards how do we celebrate this is a good achievement. How do we celebrate it? So We have £2 million to be distributed across the city for Celebrating Communities Fund. The first question that everybody asked is, how much are we going to get in this particular ward? Well, for the Reddicap ward, we're going to get £14,300. The next question, who can apply? What for and how? Now, what we're trying to promote with the games is this is about grassroots community groups. If possible, we want to see a lot more local engagement coming from it. So we're looking to try and get as many small community groups to carry out localized activities and cultural events as possible. Now, there are three key elements to the games funding. The first one is getting active. So that's about encouraging communities to get out and get active by participating in sports and recreational activities. Obviously, we are aware right now of the restrictions we have with that. Then there's the second element, which is Ready, Steady, Fun. This is about delivering community projects to ensure your local area is games ready and hosting community celebrations to develop active citizenship and reduce loneliness and social isolation. And the third element is celebrating culture. This is about developing community-led cultural events and initiatives that encourage intergenerational activities. Proposed schemes must harness the power of culture to bring people together, celebrating their identities and the culture and heritage and stories of their local communities. The funding criteria is very, very wide. Bids can be accepted between £100 and up to £1,000, so we've got a very wide spec there. All funding must be committed by August 2022. We are, however, aware of the very difficult circumstances that we're in right now, and if COVID-19 restrictions adversely impact the delivery of the projects, we are going to be lenient. So although we have a date of August 2022, it is flexible if it's necessary. The next question, if we want to see some of our small and new groups engaged, some of these may not have a constitution or a bank account. Now, normally, in normal times, we'd be working with these small groups to get both a constitution and a local bank account. Obviously, we're looking again at the COVID restrictions, so that's probably not going to be possible. So what we're actually going to do is we're going to have sponsors wherever possible for a small group. So if we've got a small group, say a local road that just wants to do a quick community engagement program and they haven't got a bank account, we'll try and find a major sponsor that can actually accept the funding for them and then pass that funding on to them. So we're trying to be as flexible as we possibly can. What we also want to look at then is what can the funding actually be applied for. So you can apply for core costs, which is essential running costs, and there's a lot of external funding groups that won't do that. So funding must be used to provide additionality or to support business as usual activities. So we're even looking at business activities, business community activities, so that we can actually continue those if it fits into the Commonwealth Games themes. You can apply for revenue costs. It can be for new and existing projects, and it can be for one-off initiatives. There are the normal areas that we can't support. So we can't support for-profit businesses. National programmes without a Birmingham connection, we cannot support. Projects that are based outside of Birmingham, and projects within a ward that have already done a project. So we can't retrospectively give them money. So we do need to know about any local groups that are going to be doing activities before they begin so that we can make certain that funding's done. We can't fund them retrospectively. An unspecified expenditure for general appeals or fundraising isn't going to be acceptable, and neither is a request just to build up reserves or for political activities. Those are normal standard ones, I would hasten to add. Now, to actually make these games work, we're trying not to have a complete Birmingham City Council focus. What we're trying to do is encourage our third sector groups, our local groups, to be as built up and as capacity ready as we possibly can. So for that reason, the Commonwealth Games team will be employing 2 community support officers who will be whizzing around the city, working with small groups, getting ideas from them and then helping them with the actual application process. But what we're also going to add to that is 10 anchor agencies, very similar to what we've got at the moment with the Neighbourhood Network scheme, where third sector groups actually manage large pots of money for the city. We're hoping to have 10 anchor agencies that will be there again for these small groups to actually do any work they need with them, field any questions, come to your ward forums as and when necessary. So we will have an extra arm that isn't BCC led, because we don't want it to be run completely by Birmingham City Council. We want it to have a far more local appeal. The applications for round 1 are going to be accepted up until the 1st of June 2021. Once an application's been made, we will do some due diligence just to make certain that it fits into the criteria, that the group is who they say they are, they're not dubious, etc, etc, etc. Once the project's past this stage, the group will then be asked to submit a written or video summary. It's just a general overview of their project. And these will then be reviewed at your local forum. Now, it's the normal appeal is that can we please start the engagement early, and that includes working with the elected members and all councillors, because what we want is to have a full nice fit where everybody at that local level has had some communication, some consultation, and then we will bring back prospective projects back to the ward forum for approval. There is a second round, so the one thing I would say is don't panic, especially when we're in quite an undecided moment at the moment with COVID. Now, the round 2 bids, they will start in October, and they are going to run right the way through to January 2022 for the closing date. And that might also be a flexible date, again, if we find that we're struggling with the pandemic. So there's plenty of time. That's the one thing I would stress. This isn't a knee-jerk reaction where we have to panic. Now, the other thing I would say is that we are expecting every ward to have a ward plan and have some priorities. And I know, Councillor, we've already discussed that, so I know that's in hand with this ward, and I've got no concerns whatsoever from that perspective. But I am open to any questions if we've got any.
Anybody else got any questions before I ask John a couple?
Can I just ask, if you don't mind, what kind of ideas of awards coming up with, and you know, what kind of schemes?
We're hot off the press. You're the first ward that's actually had this discussion. So the answer to that right now is we are really, really flexible. I have had one group that started talking about increasing some play equipment. Now that fits our theme, because obviously play equipment, that's get healthy, that's about young children being engaged, that's brilliant. The one thing I would say is when we start talking about capital, we do have to be careful, because unfortunately there's always a maintenance cost that comes with it. And you could find a huge sum disappearing very quickly because we're looking at the next 21 years. So by the time you get there, it could be a couple of swings and a bench, and you might find it's a very small, tiny concrete area that we've been able to actually play. So we need to think carefully and as flexible as possible.
John, I'm just thinking of the cost here. It's grants of 100 to 1,000. 1,000 doesn't actually go very far, and we've got 2 big secondary schools in our ward that I was thinking of asking if they could present some stuff forward. Could we break that down? Say they said, you know, we've got this for this year groups and this for this year groups either side of the road, but it's going to cost 6,000 total. Yeah. Can we look at things like that?
I mean, Councillor, I would definitely say yes to that. I think the bigger, in some ways, bigger is better. Sometimes a couple of £100 is big for a small group. But in some ways, yes, bigger is better, because you can make a bigger, long-lasting impact. And I think that's something we need to think about. And I can always work with the schools. I do have a trick in bringing in external funding. So I will make this offer, because you're part of my patch, that if the schools want to contact me and if we want to start looking at some match funding, I'm sure there might be potential avenues to do that.
Yeah, that would be great if we could do some big event, even if it's outside of school time, if they'd let their facilities and engage their pupils, it all lightens it up, doesn't it?
I mean, I've worked with schools in the past to bring in some external funding for some of their programmes, so I'm sure that's possible.
And the last question I've got is probably a little bit off what you usually get. We've got Newhall Hotel that technically isn't in our patch, although the driveway starts in it. I know they would be super keen to do something that involves the community. I don't know, and I'm just spitballing. Oh, it's not spitballing, is it? You know what I mean? I'm just throwing ideas out there. You know, they've got tennis courts out the back and stuff. They might be prepared to do some, you know, old style tennis, some balls on the lawn, sort of multi-generational old school things, because Sutton's approaching its 400th anniversary as well. But the hotel are a for-profit organisation. If they were going to put on, could they almost do this to the side and do it for a day for the community?
I think potentially we would have to have some sort of community group that pitches the application on their behalf, which would be acceptable. But New Hall is one of the most historic. I live just down the road from it. One of the most historic hotels in the country. It's the oldest moated hotel, I believe, in England.
Yeah, I hope oldest.
And I even stayed at night there. Despite the fact I live 2 miles down the road.
Manor in the world.
I've actually stayed the night there just to say I've done that. It's possible we could even look at a potential heritage bid for them. So we could look at some.
Technically on our patch, but I think it affects our residents just as much as it does Warmley and Minworth, especially if you go over to Sir Alfred's Way. People just walk over the field to it.
Yeah, I think you've made a very good comment as well, Councillor, because this is, I mean, boundary patches sometimes are only seen by organisations like Birmingham City Council, and the local residents might not necessarily see that geographical line and say, well, no, that's nonsense. So I think we would also be recommending and welcoming cross-ward applications as well, if necessary. So it doesn't have to be just one individual ward that pitches it. You could double your funding that way. So it's certainly worth looking at, yes.
That's brilliant. So you'd be happy for me to get the contact details of your roving agents and put them in touch with the manager down there to see if they could come up with something?
Yeah, I think that's a definitely good idea. We haven't got them yet because we've just gone to the advertising press, so they will be with us soon. So as soon as they are, we'll give you all the details.
There's all sorts of things they could do. They could do something in the week that they invite the primary schools and the grandparents to, or there's all sorts of different.
Absolutely. And I think the idea with this programme is that it starts to build up that sort of work, and it doesn't just stop when the games disappear. So it's about that long-term engagement. How can we kickstart something that's going to be going to be beneficial to us in 5 years' time, 6 years' time, rather than just, yeah, we've done the games, that's great, and pat ourselves on the back. So I think what you're saying is brilliant. It's absolutely perfect.
Thank you ever so much. John, can we catch up on a phone call tomorrow about
we can. Yeah, I'm busy up till about, I think I'm free from about 3 o'clock onwards tomorrow.
Yeah, just call me whenever you're ready. You've got my
no problem. All right, I will do that, Councillor, most definitely.
Thank you ever so much.
Okay, cheers, guys.
Quickly before John goes, shout now. No, thank you very much. You have a nice evening there.
I'll hide in the background for a bit.
You're hiding in the background. Poor Carl's waiting to go and get his fish and chips usually when it's my ward meeting. Right, thanks ever so much. And now I think Leslie is going to update us on the waste situation, aren't you?
Yes, good evening, Councillor. Good evening all. Thanks for the invite this evening. Nice to see and be with you all. I don't think I've been to Reddicap before, so it's a first for me. A bit on waste, a bit of good news, a little bit of bad news, I guess. Obviously, through this last year with the pandemic, we've been really good and we've been able to maintain all collections, unlike some councils that have had to stop different types of collections. So we've been able to maintain it for the last year. And just to touch on what Dr Varney was saying, we took steps within our depots to put lateral testing in. So for our workforce, we test all employees twice a week to ensure, you know, we keep on top of, and that keeps our virus levels down, should we say, and it helps us to be able to get out and do our job for you. You may have noticed, or you may have noticed, we've been buying a new fleet of late. A lot of our dust carts are old. We've got some old dust carts. We've been buying new ones. We started having delivery in December, and some have come through. Some are at Penny Bar, who services your area, and we've also took delivery of a new fleet of mini sweepers. So that's the mini sweeper that comes around on the pavement and has a clear up. They're all brand new, 20 plates. So you may see them around. They're a bit quieter and a bit more efficient, so let's say. So that's really good news for us. If I can, Councillor, can I share something on screen with you so I can show you some performance? Just bear with me for 1 second.
I think you're able to.
Yeah, I did do it in my last ward forum, so fingers crossed. No, that's not the one. Sorry about this. I don't want to show you the email. I want to show you the report. Sorry, Councillor. It's something you can't prepare for. You have to do it live. Oh, there we go. Right, this report is from February. Obviously, we measure on a weekly basis but this was the end of February. And this is around our missed collections. Hopefully you can see it. I'm going to realise my screen and this is what picks up. Oops, sorry, this is what picks up Reddicap, and we're down here somewhere. There we are. So green will be our residual collections, and blue recycling. And this is where we measure ourselves per 100,000, whether we're doing well or not. And again, it fluctuates week by week. So we're not by far. We've got a little bit of work to do. And what the reason why that is on refuse collection is that our Tuesday's work when we service the area is quite a large day's work, and we're actively now looking at some of these work, upload some from Tuesday to another day, so we can have an even day to complete. What's also showed an increase, or an increase positively wise, is our new vehicles. So we're having less breakdowns. With our COVID testing, we have more people in the workplace. So unlike some wards across the city, which obviously I wouldn't name, Reddicap is doing quite well. This goes in tell with, so we're going to flick through a couple of pages because I will bore you. Our dumping rates. So again, Reddicap, I can't see because I've got my screen's covered, but down this bottom end here, I've got Reddicap. I'm not sure if you can see. So I don't know the figure off the top of my head. I can't move because I changed the page. But compared to some of the other wards in the city, Reddicap for dumping fares quite well. So we feel we are doing a lot of work to reduce it still further. And in waste management, we've been able to gain some monies that's coming to us very shortly. And we're just about to recruit. Now, this extra monies will be in the form of dumping crews, some extra graffiti crews, and some bulky waste crews. And we're also recruiting to what we're calling Love Your Streets. And like John was just saying with the Commonwealth Games, we want to build up a new regime of residents coming out, working with us, working in the community, keeping, doing our bit for our area where we live, because I think we all understand that lots of cuts that the city or the country's been through has left us quite short on cash. So we're trying to engage and get people to come and love where you live, basically. And obviously, we'll be around Reddicap at some stage through the summer once the restrictions are lifted. And I do feel it'd be really, really good. So if anybody is in a group and they want to do a bit where they live, I live in South Yardley, I'm a part of the group here. Please let us know and we'll come. We can supply things like litter pickers and bags. And we can all get involved together. So
one of the challenges we've got is that actually the missed collections, if I'm correct, only register if somebody reports it through the Birmingham City Council system, don't they? They don't register all the stuff that we report as well. And we have quite a high incidence of the same houses or the same roads being missed over and over. And then when they are, and they come and pick up, having had their collections missed, the bin crews won't take the bin if it's over full, or they leave waste behind when it's not the resident's fault that it hasn't been collected on time. And also with a 5% rise on council tax and Band D property now charging £2,500 a year, they don't expect to come and pick up their own rubbish. And I think that's really reasonable. Our residents pay on average a much higher council tax than a lot of areas in the city, and they don't expect to pick up their own waste. They expect that service to be provided.
Yeah, I mean, obviously, I couldn't really comment on council tax because I don't set it, obviously, etc. But if we do make miscollections, when we do come out, we should clear everything's presented. So if we're a week late, it's obvious people generate more waste. We should be clearing.
And I appreciate it. It's not you personally that does it, but that simply doesn't happen. I have it regularly at my house. I have residents regularly reporting it to me. It doesn't happen. They don't take the extra waste if they're late, and it's the same residents getting left behind. And there aren't, if council tax is increasing that much, it's not cuts. Our residents are not having cut what they're paying for the services, and they expect that to be regular and consistent. And I know that you're just the person who stood there, but this is the thing that I get day in, day out, and it's the bread and butter of the council. It's the thing that annoys people more than anything, is when the waste service doesn't doesn't run fluidly for them.
Yeah, I mean, I completely understand what you're saying, Councillor, and you know, a lot of people actually balance the council on what we do, because you know, we come to everybody's house every week, not much like a library where people might visit every now and again. So I do it, and I do feel the pain that you get. If you get repeat ones like that, Councillor, write to me, please, because I can action a recourse to put it right. So, you know, we will always have miscollections from time to time. But it concerns me if we get repeat ones and I'm not knowing about them. And it also concerns me if people are presenting waste because we missed the collection and we're leaving the excess. So the first thing I would say is contact the contact centre.
Some time ago, we used to have a direct phone line for the depot, and we don't have that anymore. That, I think, would be something that could make quite a big difference to people if we had a direct contact number for the depot once again.
Yeah, it is quite difficult with the current pandemic and the mobile working, etc. That does create a problem for us. But if you was to contact, you know, yourself and you put in the BCC councillor's number when you make a contact, that then gets filtered down to the depot as in a direct contact, and that leaves a trail then as well that you know, you've contacted for a reason and you're expected to get a response. And I think our response rate is somewhere in the 99%. So, you know, if a concern is raised by yourself, if you copy in BCC councillors' inquiries, they go straight to the depot, they ask for a response on why it's been missed. More importantly, why has it been missed again? Because we don't want to get it wrong twice, obviously. And they will give you a response. That will come to people like myself, who will speak to the crews and the managers to make sure repeat miscollections and repeated left waste gets dealt with, and the crews are dealt with appropriately if they continue to do it.
Thank you.
Could I ask a question? Am I allowed to ask a question? Sorry.
Leslie's all right with it. I am.
I was just going to ask, a lot of residents are still waiting for their green waste stickers. Across Sutton actually, so green bins are being collected, which is good obviously, but still now, this is the second or third week since the service resumed, a lot of residents, including myself actually, are waiting for our green stickers to come through. Do you know when that will be resolved? Because I personally have contacted the council and I haven't heard anything back. I've gone for the government Birmingham City Council website, so I know I'm not the only one, because the talk is generally on the streets that, you know, people are still waiting for them.
Yes, Mr. Parkin, I do know we've had a bit of an hiccup with delivery of those. As I'm understanding it, they're being delivered now, or if not as we speak, and I think they're going to be putting them out on your next collection day. I will have to check that, and I'll obviously write to yourself, Councillor, to confirm when they are going out. But as long as we're collecting your bin, that's the main objective. So you've advised you are.
Those stickers in the next week or so, from the sound of it.
Yeah, I don't know. I couldn't answer you straight now, but I'll write to yourself, Councillor, once I've checked. And then if people want to ask yourself, you can give them the right information.
Thanks, Leslie. Okay, thank you. Enjoy your evening.
Thank you. Thanks for the invites. And
thanks a lot.
Please, anytime you can invite me, I'm quite happy to come along.
Brilliant. We'll have biscuits when we all meet in person. Right, and last we've got Carl, who's always so patient, waiting there to give us an update about the roads. Carl, haven't you?
Thank you very much, Councillor. Yes, and good evening, everybody.
And I'll just say up front, I know Carl's been trying really hard to get an issue around some of the side roads off Sir Alfred's Way to actually get a proper, permanent, decent size, long-term repair done down there, rather than dealing with it all piecemeal. So thanks for what you're trying to get done down there.
Thank you very much. Yes, there's quite a number of roads still to be resurfaced, whether it's patches, whole sections, roads, footways. There's a lot of work to be done. A lot of us know there was issues with the previous AMI contract. a lot of the work didn't get done. It was just reactive patching only while the dispute was running through the courts. Then, of course, Amy and Birmingham City Council parted company on the contract, and now we have Kia Highways, who are the interim service providers for around the next 12 months or so of the remaining interim period. They're trying to do a lot of this work, and also we have Tarmac working with us, doing an awful lot of work across the city, including Sutton Coalfield, and it will take time to get round to all these locations. But I believe Sir Alfred's Way is having some work done now, but we are still fighting to get some of the other roads done. Specifically in your ward as well, we've been busy working on a number of things. Quite recently, as you'll be aware, we did a 20-mile-an-hour section of a speed limit on Reddicap Heath Road to include Stanley Avenue, and a section of Fairfax Road to include the school. Most of that area already had speed cushions, so the 20-mile-an-hour should hopefully complement the area that picks up the two schools, Fairfax, John Wilmot. We've also done some minor parking restrictions on Fairfax Road as well. We learn as we go along where people are parking, what's necessary, what will help traffic flows, etc. And so as and when we can, we do add sections in. This year we're doing quite a lot of work on accessibility. The priorities in your ward this year have been around drop curb access for wheelchairs, mobility scooters, blind, partially sighted, pushchair users, etc. We're doing a lot of drop curb activities, lowering the curbs at the end of the roads for much easier access. And these are around the Langley Hall Road, Wyatt Road, Springfield Road, St Martin's Road, Rectory Road, Myring Drive, and Carhampton Road, etc. We're always happy to take requests for additional locations. We maintain a request list for every ward across the areas that I look after, and that way whenever we get a funding stream or additional funding, we have almost like a pick list where we can go to say, right, these have been requested, these are on our list, these are justified, and when it's just a case of needing the money and that comes in, then we can simply go down the list and start ticking off everything that is outstanding with us. And I'm happy to take any questions.
I just think that Kira may be slightly better than Amy, but they still don't reply as quickly as I think you or I would like, or they're still going, yeah, they still take their time and they still argue over the level of repair needed, but I know you're doing your best.
Thank you.
So thank you. Anybody? No? Well, thank you, Carl. Fish and chip time for you.
Thank you very much. You remembered.
Always. Thanks.
Okay, thank you.
So, Leslie, I think that's the agenda, isn't it? Do we have anything else to go through?
No, there's no questions come in. I don't know whether you've got any urgent items or any council updates you want to give, but yeah, that's it.
No, I mean, the only council update is that we haven't had an update on when council will resume in person yet. So for the foreseeable, we're on Zoom and Teams, etc. But hopefully we will get back to normality at some point over the spring and summer. So I'm happy to take any questions if anybody's got any.
No, I don't. No more questions have come in, councillor.
Okay, that's great. Thanks ever so much.
Okay.
Thank you both, Richard, and I can't see who else is on because I haven't got the name on it, but thank you both.
Thank you all very much.
Good night. Leslie, can you and I just